All right, Gannon, Thursdays, you know, we always set aside the time to talk with people from the medical community. Today, Dr. Janalynn Beste, coming in from New Hanover Regional Medical Center's Coastal Family Medicine. We're talking about football. That's what we were just saying in the break. We're going to talk about football.
I'm great.
She's ready.
That.
We can
I'm
do
ready.
it. Instead, we're going to talk about the human papillomavirus,
yes,
which, oddly enough, isn't just one virus into itself.
No, actually, human papillomavirus is a group of over 100 viruses, which can cause everything from warts, both genital warts and skin warts, but can also cause cancer, particularly cervical cancer in women, as well as mouth and neck cancers in men.
In the information that was sent over to me, one of the things that jumped off to me was this is not a gender-specific virus.
It's not. There's about 33,000 cases of cancer that are caused by HPV each year, and 20,000 are in women, but 10,000 are in men.
When it is so broad, when you're talking about 150 upwards of more than that viruses in this one HPV, how do we know if we've got something going on?
So one of the dangerous things about this is you often don't.
Okay.
The certain viruses that cause warts, you can see warts, they can show up on your hands, on your feet, they also can show up as genital warts, but the viruses that cause cancer, you can't detect them.
So if you think you have a problem, at what point do you think, I've got, not that I'm sharing this with you.
We need to talk.
No, well, I don't know. You tell me. I have a wart on my toe. Been there for years. I mean, is it as simple as you see a wart and you think, well, I mean, could it be?
So the types of HPV viruses that cause warts are not the same kind that can cause cancer,
okay,
so they're dealt with differently. The ones that can cause cancer are detected in women with pap smears. The ones that cause mouth and throat cancers are just detected by you finding a bump and going to your doctor and having it checked out.
Yeah, and I was going to ask you, when we're talking cancer, again, people hear that word and the fright and the fear comes in. Significant kinds of cancer associated with this?
Well, cervical cancer, again, can be detected early if women are going in for regular checkups. The cancers of the head and neck, which are relatively new in their discovery that those are related to HPV, if you notice something, go in and get it checked out.
As far as prevention, is there anything, because we ran a story earlier about it, things can be as simple as touching a surface. What can we do to protect ourselves?
So the most important thing you can do is get your children vaccinated. This is actually a really exciting thing that fairly recently we've developed a vaccine that can prevent this. It's recommended that kids get 3 shots over the course of 6 months. Somewhere about the ages of 11 to 12.
Okay.
So going into 6th grade with all the other 6th grade shots.
Nice. I'm doing the math in my head. I've got 3 more years. My kid's just starting 3rd grade this year.
I have an 11-year-old. She got her first one last month. She's not excited about having to get 2 more.
How much fun having a doctor as a mom? And
they're always getting shots.
You got to get your shots.
They're always getting
shots.
shots.
The first thing out of my kids, am I going to get poked? You're going to get poked when you go today?
Yeah.
See, they're not watching because they're at school, but girls, 3 more years, you're getting poked. And if you think you may need a poke, again, don't email me, don't call me. I'm just the guy on TV. She wears the white coat for a reason.
Absolutely.
So you always want to contact your doctors. Doctor, I appreciate the time this morning.
Great, thank you.
Thank you very much. And